Hi everyone, welcome to Center of Balance. I'm Sinan Pua from Center of Balance, the acupuncturist and Chinese medicine herbalist. Hey, my camera today, I got two cameras in front of me, and this is for YouTube and my acupuncture teaching on YouTube, and as well as my clinic Facebook. And I have another camera over here for another YouTube and my clinic one. Okay. If you here, please give me a thumbs up and say hi to me. And I hope you enjoy this live today. What is our topic today? So I'm going to talk about causes of female infertility. So one of our focus in our clinic for the last 16 years, we treat a lot of infertility cases, helping female infertility cases and male infertility cases to help them conceive naturally, or to help them increase the fertility chance to get pregnant through IVF. So and people come to our clinic and we want to figure out what's going on and what causes the infertility, right? So I've talked about male infertility last week. And today I'm going to talk about female infertility causes. So female infertility can be caused by a variety of factors that affect or interfere with the following biological processes. Mainly we categorize into three. Okay, number one is ovulation. Ovulation, when the mature egg is released from the ovary, that called ovulation. So basically, we have our way to figure out whether you ovulation properly or not. So what is the way for us to figure it out? Right now, doing some tests, blood tests, hormone test, to look at the progesterone and estrogens, to look at the level, whether they're normal or not. This one way, but another way we call BBT chart. BBT is basal body temperature that require you to take your temperature every morning, first thing in the morning. Like as soon as you open your eyes, and you put a thermometer under your tongue, then for a few minutes, up to 5 minutes, then you take the reading, put it all together, and then we can see the temperature change every day. Then we're able to determine whether you ovulation or not. So there's one way, okay? And second one is fertilization, which occurs when sperm meets the egg in the fallopian tube after traveling through the cervix and uterus. So this part is important too. And in Chinese medicine and acupuncture, we will help you get more blood flow and more relaxed for your body. So for fertilization, when eggs and sperm meet together and they can become embryo, right? They become embryo, and the embryo, what's the embryo going to do? They're going to implant. So the next one is called implantation. So before we go into implantation, let's talk about more about fertilization. So to get fertilization properly, of course, for female, you need more blood, circulation. So one of the factors in here is we do blood tests. We suggest you do blood tests. To test what? We know the blood, resource of the blood is iron and B12. So we need to make sure that you have good enough B12 and iron. And in iron, we test two things. One thing is the iron itself. The other thing we call it ferritin. Ferritin is a protein that actually showing that whether you have the ability to store iron. So those two tests are important. Now, a lot of people didn't realize that. And that is something that we suggest all our infertility patients to get tested for. Female, I mean. Now, of course, we can talk about more about the egg quality, right? To make sure the fertilization is when it meets the sperm, it can become embryo. Then we need to make sure the quality of the egg, right? And that is more we need to talk about the diet, about the you have enough blood or not, and whether you're making the eggs properly or not, whether the eggs can release or not. We'll talk about that before ovulation, right? So there are more to talk about, but today we're not going to go deep. But in my other video, I'm going to talk about all this little part, like make it into like ovulation is a topic, and fertilization is a topic, and plantation. And let's go into implantation. So implantation, now we talk about fertilization, right? Eggs and sperm meet together, become embryo, and those embryos need to implant properly in your uterus. So implantation, that is the next one, which occur when a fertilized egg attaches to the lining of the uterus, where it can then grow and develop into a baby. So the fertilization, the important thing in here is the lining of the uterus for female. Now, the lining is basically the blood. Now we talk about the iron B12, right? The reason we want to make sure of that is because we want you to get enough lining. So the lining should be 8 to 9 mm thick, right? That to be able to hold a baby. It keep growing, it keep growing. When you're up to your ovulation, if you have if you go through IVF, you normally get that. You get that measuring by skin, doing a skin test. And they will tell you that, oh, yep, you got good enough and very thick enough lining. Let's get the embryo transfer, right? So that is in IVF. And back in China, we our master, when we saw infertility patient, and we actually get our patient before they come for taking the pulse, seeing the tongue, and get the prescription or acupuncture, leaning to the ovulation. So we get our patient actually get some skin to look at the lining and see how thick the lining. So that help us to prescribe the herbs. With this patient, we need to do some herbs for them to help release the eggs, or we actually can prepare to, we need to build some more blood for it to build up the lining, because the lining is not thick enough. So back in New Zealand, in my practice, we don't have, as my practice, I can't get you to get a test for skin for lining. If you want to get a naturally birth, So therefore, we use other tests. The test that we do is look at your period, the bleeding. So now we know the lining. When you're not pregnant, or ovulation time, if you're not pregnant, and the lining keep growing, and then when you reach 28 days, the lining fall. When it fall, it becomes blood again, fresh bleeding. That's how you get your menstruations. Now, in this case, when you get your menstruations, we find out from your menstruation situations, like the information from there is you should get 5 days, 4 or 5 day bleeding, and every day you should change about 4 pads, and that's normal, right? So when you change about 4 pads every day, or maybe full pads, then we know you have good enough blood. Then we know you have good enough lining. That makes sense? Yeah. If you have only 1 or 2 pads, or it's just very light flow of bleeding, then we know you haven't got enough lining. The lining is less. So in our treatment, it actually lead to, when it lead to our treatment, we actually want to build blood for you, right? This 3 things, it help us, like ovulation, fertilization, implantation. We figured out what's going on, and then in acupuncture and Chinese herbs, we're able to give you the proper treatment. You know, a diagnosis first, and then treatment. So we get all the information from you, BBT chart, checking your period, and to look at what's going, how many blood do you have every day, blood flow, heavy, light, or just medium, or things like this. All right, I hope that makes sense to you. Now, those are the 3 things, okay? Ovulation, fertilization, implantation, those 3 causes of female infertility. Now, next, let's move to the risk factor. So the risk factors for female infertility include increasing age. While as we age, we know the eggs quality drop, you know. So increasing age is not funny at all. It's not good at all. We know that. So you want to get pregnant, get it. You want to have a baby. I do suggest you try earlier, have earlier. When you hit to 40, and chance much less, over 35 much less, and 40 even less. Okay, so if you need, if your age is coming to 40, please, apart from going to your doctor, do see a Chinese practitioner. You know, acupuncture and Chinese herbs may help you increase the chance of pregnancy. Smoking cigarettes. We talked about this last time when we talked about the risk factor for male infertility. Smoking cigarettes, it's come to the, we know when we smoking, right? When you're smoking and it go into your lung over here. That's your lung, right? So what's the lung function? The toxin of the cigarette, it will go into your lung, go into your blood to breathe in, right? The lung that we use, the main function of the lung in here is we breathe in oxygen. And this oxygen are important because the oxygen go into the blood, right? Then your blood carry the oxygens, go to your entire body to nourish your body. And again, in here, we need blood, we need oxygen, go and nourish to make eggs. to make sure that when you can get a proper ovulation and fertilization, because the embryo need blood, need oxygen. You know, when an implant, we talk implantation, we talk about that the lining is built from blood. So the blood, the oxygen inside, is the nutrients that the embryo need, the baby needed. So smoking, think about smoking. You get the toxin from cigarettes go into your blood instead of more oxygen. When you get toxin into your lung, you get less oxygen, you get more toxin from the cigarettes into your blood. So that is very unhealthy. That is why we suggest when female come to a clinic for infertility, if they are smoking, we say, hey, please, if you want a healthy baby, if you want to get pregnant, please stop smoking. That is very important. I know you may tell me, I have a lot of friends, they're smoking and they have baby. I know, I definitely see a lot of them, right? So, but again, there's a lot of research that talk about cigarettes. It's not good for baby. It harms the baby, and not good for infertility. So I hope when you look at this video, when I share with you, you take the action and stop smoking. Thank you. And the next one, heavy use of alcohol. Again, alcohol, you start to know alcohol, you want a healthy baby, we all know it, you know, alcohol is not good, alcohol is not good. So please stop smoking as well as alcohol when you prepare for pregnancy, conceive. Being overweight, obese, or significantly underweight. So yes, overweight is very unhealthy. It actually, one of the main thing that in here, one of the causes for female infertility, we call PCOS, polycystic ovary symptoms. And one of the symptoms is overweight. Overweight that are not healthy, so that it can cause from overweight. So manage your weight is a very good idea when it comes to fertility treatment. Now, underweight is not good either, because underweight actually indicate that the blood is very, you don't have enough nutrients. We've seen people, athletic, they train a lot. They look like very healthy, good muscle and everything, you know. But the one thing is they haven't got enough blood. How do we know that? Look at the period. So if you have just 1 or 2 days of bleeding, that means you haven't got enough blood. Well, in this case, maybe you're underweight, maybe you're overweight. When you're overweight, you haven't got enough blood because your blood go into grow other things using the blood a lot, but it doesn't actually keep going to your uterus. So that kind of not enough blood and underweight, not enough blood, not enough bleeding, you know, it's a bit different. We treat it a bit different, okay? So do come to see us, because we'll be able to help you to figure out what's going on, and we can suggest you what can help you, you know, which way can you in your diet that you can build up your lining and build up your blood system. Okay, having certain sexually transmitted infection, which we call STIs. That is the infection, and that can damage the reproductive system. If you get, let's say, well, the simple one is UTI. UTI. A lot of people get UTI, and if you get it very often, like each time you have your period, you get UTI. and that's very unhealthy. I have patients get UTI every month, and not until you fix the UTI, our focus is fix the UTI. When you haven't got a UTI, which means every month you don't have the symptom, that's good, because it can prevent you get pregnant, a symptom of the UTIs. So what are the symptoms? A normal symptom is you have an unusual discharge. The discharge could be, the UTI is different. When you pass urine, you get burning sensation, you get some blood in there. That means that you have infection, right? But other infection that is not is a bit different with UTI. UTI is infection in the bladder or kidney, right? The vagina itchiness or rashes are unusual discharge or pain that's from the vagina, and that could be an issue that if it keep happening, that can prevent you conceive. So that is very, very important too. So do get it treated, and do go and see your doctor and fix the infection first if you want to get pregnant. Or come to Chinese medicine, come to us, or acupuncture, because we use Chinese herb. We will help you to sort out your infection first before if you want to get pregnant. All right. I think that's it for today. I hope the information that I just talked about on the above and help you to understand the causes of infertility, female infertility, and the risk factors as well. So next time we're going to talk about, we still talk about fertility. I'm in charge of the fertility part this time. And Kevin, while in charge of pain conditions, if you need any treatment or any advice, please give us a call. And our phone number is down there. You can call us 0800 221 224. We have clinic in Riverlea, Auckland, and clinic in Dinsdale, Hamilton. We will help you. And no matter where you are, we can suggest you to get a local acupuncturist to help you. Also, we'll be able to do online consultation to help you prescribe herbs to you. So no matter where you are, we will just help you with Chinese herbs. Probably not acupuncture, but we can do acupressure point, right? But stay awesome, and I'll see you next time. If you're an acupuncturist and you want to join our online training, we'll be able to help you with online training, so you can start treat. You understand how to treat and learn how to treat infertility, right? And drop your message down there. Right. See you next time. Bye bye.